Hello, everyone. Good afternoon, good evening, or good morning, wherever you are today, this beautiful Wednesday. Hi, good to see you all. I wait for a few seconds so people can join us, and then I'm gonna invite Dr. Jenn Simmons. Good to see you all. Let me know where you're coming from today. So as usual, I just want you to, if you have any questions, you can either type it in the comment or in the question box. And once we talked about the topic today, if we had a chance to go through those questions, absolutely, we will address your questions and answer as many as we can. So our lovely guest today is Dr. Jenn Simmons, a renowned breast surgeon and functional doctor. So you can ask any question about breast health, breast concerns, cancer, hormones, anything. Hi from Vancouver, from Montreal. Hi. Good to see you all. We are going to wait. Someone is asking about thyroid. Sure. If we have a chance, we're going to talk about thyroid too. Yes, so many questions. Some questions about breast cancer. Hi. Good to wave. Nice to meet you all. Let me just try to invite. Hi, someone from India. Oh, hi.
Oh, hi.
Good to see you,
It's good
Dr.
to be
Jenn.
seen. I'm so happy to be here.
Yes. Thank you for accepting the invitation.
Of course, my pleasure.
It's great. I met you first last year in Vegas Summit A4M.
Yeah.
Yes, your talk, lovely talk. And since then, I'm following you. I listen to your podcasts. It's great, very informative podcast. I loved actually the one with Dr. Barber, the OBGYN. I
Yeah.
many of
Yeah.
them, but it was
Dr.
interesting.
Tabitha is amazing.
Yes,
Yeah,
she was talking about how she's an OBGYN now, functional doctor, and how minimum and basic their training was in hormones. And
yeah.
yet we
It's
refer.
frightening. It's
Yes,
frightening because we think of our gynecologists as the hormone experts,
exactly.
and they actually get no training in
Yeah,
hormones.
I know.
And so we kind of like throw them in the fire, and they do the only thing that they are trained to do, which is to prescribe birth control pills.
Exactly.
And for so many women, it makes the problem worse and not better.
No.
Yeah.
So before we get into juicy nitty gritty, can you share with us your background and
Sure.
how did you
Sure.
get here with all the experience in breast cancer? We love to
Yeah.
hear.
Yeah. So I come from a breast cancer family. I actually don't remember a time in my life where I didn't know about breast cancer. It was part of the fabric, the thread of my childhood. every woman in my family got breast cancer. And I really grew up thinking that I was destined for breast cancer because it's what happened to every woman in my family. And as a child, I had a first cousin who was a singer-songwriter in the 1970s and 1980s. She wrote all the music for the Spinners and the Stylistics. She wrote 54 hits in all. And her most famous song was The Greatest Love of All. And she wrote that song originally as the title track to the movie The Greatest, starring Muhammad Ali. But it really received its acclaim in March of 1986 when Whitney Houston would release that song to the world. And at that time, it would spend 14 weeks at the top of the charts. Only my cousin Linda would never know because she was diagnosed with metastatic breast cancer 1 month after Whitney released that song. And I was 16 years old at the time, and my hero died. And so her life and ultimately her death gave birth to my life's purpose. And that's really why I became a breast doctor. It's why I became a surgeon. It's why I focused on breast cancer. And then later on, when I became a patient, though I didn't have breast cancer, I had thyroid. When you're a patient and facing your own treatment, your own surgery, your own chemo, your own radiation, your perspective changes a whole heck of a lot. And I was very comfortable telling women to have surgery to remove a vital organ and to have chemotherapy and to have radiation. But when those words were coming at me, I didn't want it. I didn't want it. And so I ended up going on a journey to figure out how to heal myself. And in that, I discovered functional medicine, and it was a bell I couldn't unring. Yeah. So I healed myself. It took 3 years, but after I healed myself and learned about functional medicine, I knew that I couldn't stay as a surgeon. I couldn't stay in that place. I was no longer practicing from integrity because as a surgeon, I was focused on what the entire medical system was focused on, the symptom. I was focused on the tumor. I thought the tumor was the problem. And never until I had my own illness, never until I was a patient, never until I learned about functional medicine did I realize that the tumor's not the problem. The tumor's the symptom of the problem. And if we're really going to make a difference, if we're really going to change the trajectory that people are on, if we're really going to help them to recover their health and live as long as possible and die young, then we have to get to the root of the problem and give them the tools that they need to build their health.
Absolutely.
So that was really the turning point and the changing point for me. I don't think I would have ever left surgery. I would have never had this perspective unless I became a patient myself. So while our diagnoses are not blessings, they are opportunities. And if you can use them as that, use them as an opportunity to reevaluate, to look at your life, your world, your environment, figure out what's working, more importantly, figure out what's not working, and put you on a different path going forward. Yeah,
That's true. Yes. So let's talk about cancer. So we're hearing it now. So many people having different types of cancers, and there's a
I think the number is now 1 in 3
Yes.
in your lifetime. 1 in 3 people will have cancer in their lifetime.
I know.
Yeah.
It's
So these are pretty staggering statistics, right?
Yes. So why? So what is cancer? First thing, how do you
for
explain
sure.
what is
So Cancer is a normal response to an abnormal environment. And it is the environment that we're living in today that is why these cancer statistics are so high and so staggering. And when I say the environment, I mean everything from what's inside of you, what you're putting inside of you, with diet, with water, with all of that. I mean what you're living around, but I also mean what is the living environment that you have, in that what is the health of your relationships? Because we know that you're only as healthy as your 5 closest relationships. And so if you are in a job that makes you unhappy, that you're going to every single day, if you're working amongst people who are miserable and you're exposed to that every single day, if you're in a bad relationship, if you're in a bad marriage, if you're taking care of a sick parent or a sick child, all of these things weigh heavily on what your chemistry is like. And if you are in that is toxic to your cells. And your cells are going to respond by going into survival mode. That's all cancer is it's your cells going into survival mode because they're threatened. So I always use this example. No matter how small, think about what an animal that is cornered behaves like. So I have my 5-pound dog here. This is Teddy. And I can assure you, as sweet as he is, he's the love of my life. As sweet as he is, if he is afraid or feels threatened, he turns into 5 pounds of teeth. He is ferocious. And that is the same thing that's happening on a cellular level in our body when these cells feel threatened. They go into survival mode, and all they're thinking about is procreating. And they don't care if they're doing it correctly or not. So the mistaken cells don't care, just survive. Deformed cells don't care, just survive. And that's what's happening. So what we all need to do, and this is, I want people to do this before they get a cancer diagnosis. I'm trying to prevent the cancer diagnosis. I mean, of course, my life's work is helping people who already have one, but I would like to be put out of business. If we're being honest, I want people to not get the cancer diagnosis. So what we all need to do is send up that safe flag. Tell our bodies that it's okay, that everything is good. But you can only fool your body for so long. So yes, you can meditate and create that safe space. But if you walk away from your meditative session into danger, it's not going to work. And so it's all about creating that environment that is safe. And when you do that, you're rewarded with health and disease goes away.
So as we in old times, we thought it's all about genetics. That's what it's cancer. Now we talk so much about epigenetics, how environment, how our lifestyle affect our body and health.
Yeah,
exactly.
That's exactly right. So genetics is a part of it without question, but it's a very small part of it, a tiny part of it. And even in those families that have a BRCA mutation or one of the high-risk mutations, we have to remember those mutations are in tumor suppressor genes. Those are protective genes that you're born with a damaged copy of. No one's born with 2 damaged copies because that's not compatible with life, but you're born with a damaged copy of. But that doesn't make you more susceptible to getting cancer for any other reason than you're just you're not as good as other people at making the repairs. So you are more susceptible to environmental insults. And so those people have to be more careful than most about the environmental insults. Now, this is a great example of what not to do, because we take that BRCA mutation carrier, that they already have a defect in their repair genes. And what do we say to these women? You're at high risk for breast cancer. You should get screened early and often. And this is a way to guarantee that they get breast cancer. All you need to do is subject these women to radiation, and you will guarantee that they get breast cancer. We are so backwards in our thinking. Our society is built on rewarding illness, and our doctors don't know how to get paid. Our hospitals don't know how to get paid when people are well. And so that has become what's of value, is people getting sick so that they can get treated. And nowhere along the way are people being taught how to be healthy, what interferes with health, how to avoid it. We're not taught to live our best lives at all. And it's a sin. It's a sin. So genetics is a factor, yes, but it's a very small factor. And what you referred to, the epigenetics, the things that we do that influence our genes, that influence which genes are turned on and which genes are turned off, that's what's important. And that's what we need to be talking about all the time, but we're not.
No, we don't.
Yeah.
What are the main risk factors then for breast cancer?
So the number one risk factor for breast cancer is not going to change. It's being a woman. Because the more breast tissue you have, the more likely you are to get breast cancer. The second highest risk for breast cancer is age. Because the longer you're on this earth, the more likely it is that you're exposed to more toxins. But those are the two risk factors that you cannot modify. Everything else you can. So the reason that breast cancer runs in families is not because of the genetics. It's because you tend to live in the same environment, eat the same way, relate to people around you the same way, think the same way, and get similar exposures, which is why we see history repeat itself. It's generational trauma, right? It's living that same way over and over and over again and expecting a different outcome. However, the people that break out of that paradigm, the people, like for instance, I come from a family where every single person in every single generation was overweight or obese. But I broke that pattern because I didn't want to do that, and I didn't want to live my life that way. So does being overweight or obese run in my family? 100%. Does that mean that I was destined to do that? No, because it's a conscious choice that I made. Now, could I easily be overweight or obese? 100%. Do I have to fight every single day to remain healthy and in shape? 100%. But am I ever going to be like a model and a waif? No. That's where my genetics holds me back. But I'm going to make sure like hell that I'm not overweight. And so these are things that we can control, but it takes an active effort. And health is something that has to be achieved. It is not a passive process. This is an active process where you have to be actively engaged in order to be healthy.
Yes.
I'm sorry. Can you hear my dog barking in the background? I apologize.
Soon my dog will respond, sitting on the other side.
I'm so sorry. I'm so sorry. My dogs always pick when I'm on a live to start to talk to one another.
Oh. Talking about being overweight, obesity is one of the risk factors for breast cancer. And
that one is a little bit a chicken or the egg. So there's two factors to look at there. First of all, most people who are obese have a lot of visceral adiposity, meaning that they're depositing these fat cells in and around the organs in their abdomen. And those fat cells are not benign. Those fat cells are secreting cytokines, adipokines that are toxic. And so that's one problem with it. The other problem with it is that, and this is where the chicken or the egg part comes in, the place that we store our toxins is in fat cells. That is our protective mechanism. That's how the body shields itself from the toxins in your environment. So if your blood is overloaded with toxins, your body will get signal to create fat cells in order to deposit the toxins in. And when you've utilized all that space, it creates more fat cells to deposit more toxins. And so are you toxic because you're overweight, or are you overweight because you're toxic? This is the body's protective mechanism. And it's a feed forward cycle. So the more toxic you are, the more fat cells you're going to create. And this is a cycle that needs to be broken. So if you're stuck in that cycle, that's why we talk so much about detoxification, because you have to stop putting all the toxins in your body, and you have to work hard on getting the ones that are there out in order to lose weight. And there's no way that your body is going to let go of those fat stores if there's still a lot of toxins circulating around your body. And that's why, as people do different things to get rid of toxins, like for instance, the mouth is a big place that harbors toxins for people who have had root canals in the past. If you've had wisdom tooth extraction and you form cavitations there, if you have mercury or silver amalgams in your mouth, all of these things contribute to a large amount of toxicity. So until you get rid of that source, it's going to be very, very hard for you to get rid of your fat cells, because that's the way your body is trying to protect you.
Yes, and that is again the start of the gut health start. So that's why we talk about it so much.
Absolutely.
Yeah, the health of gut is so important, or the microbiome.
Yes, yes. And while I think that is a word that more people are becoming familiar with, most people don't know what to do with that information and how to manage that. And the truth is that we need to avoid the things that we know damage the microbiome. So those are things like non-steroidal anti-inflammatories or steroids, or all the things that come along with processed foods like pesticides and herbicides and fungicides. All the processed foods, that is a huge problem for the microbiome, because if we are eating things that are not actually food, that is very destructive to the microbiome and causes dysbiosis or imbalances. Alcohol is very destructive to the microbiome. Over exercise is destructive to the microbiome. Under exercise, eating too often, eating not often enough. Like there are so many things that go into proper microbiome development, and we're just not talking about them enough. And I don't know if it's that your primary care physician doesn't understand enough about it, or that it's just not become mainstream enough, but we need to be talking about it more, because the microbiome, most of our microbiome lives in our gut, although we have microbiomes all over our body. There's a microbiome of the mouth, of the eyes, of the ears, of the nose, of the vagina. Like, we have microbiomes everywhere. Skin, everything that has contact with the outside world has a microbiome. But most of it lives in our gut. And that's also where we house 70% of our immune system. So these are in constant communication with one another. And it is impossible to have an intact immune system if you don't have a healthy microbiome. Mm-hmm. So if for no other reason, we need to protect the health of our microbiome so that we can be well. And as we have these genetic conversations, from a genetic standpoint, we're only 10% human. 90% of our genetic information comes from our microbiome, which is why when people undergo genetic testing and think that that's the be all end all, that's a tiny part of the story, because most of our genetic information is coming from our microbiome. Mm-hmm. So we should work like hell to protect the 90% of our genes.
I know. That's true.
Yeah.
Wow.
Yeah. And the biggest part of that is eating an unprocessed whole food diet, chewing your food, having proper digestion, so that when it gets to the part of the gut where the immune system lives, which is in the small intestine, it can recognize it as food.
Mm-hmm. Yes. So we had that lovely big study, Women's Health Initiative, back in 2002. Up to then, everything was fun. Everything was great. Women were taking, although different types of hormones, but they were on hormones.
Yes.
And then we had this huge study and the huge scare and fear of breast cancer.
Yeah.
So tell us a little bit about that and the link between estrogen and breast cancer, if there is any.
So let's be clear that even the results of that study, which was a very poorly done study and did not answer the question that it was asking, mostly because the population of the study was totally inappropriate, and I'm happy to get into that. But even in that poorly designed study, we saw that estrogen is protective. And of course, estrogen is protective because estrogen is the molecule of life. Mm-hmm. And we all of us start to die when our estrogen is depleted. Mm-hmm. Every single system, because we have estrogen receptors everywhere in our body, every single system suffers when we stop making estrogen. So starting with, when we look at women in that perimenopause to menopause is about a 10-year process. But once you're done, the next 10 years of your life are when the major deterioration happens. Mm-hmm. And the systems that are most evidently affected during that time are the heart. Both the musculature of the heart becomes stiff because that's what happens to muscles that don't have estrogen, but also the vessels of the heart become damaged because estrogen protects the endothelium, or the lining of the blood vessels. So basically your heart is a muscle that is fed by blood vessels. So major cardiac deterioration happens during that time, and women go from, they have much less of a risk of heart disease as compared to men until after menopause, at which time the playing field evens out. Mm-hmm. Because without the protection of estrogen, your blood vessels suffer and your heart muscle suffers. Mm-hmm. And then the brain, the increase in dementia goes up significantly after menopause. And not only dementia, but things that we think about, the softer sides, like brain fog and having word search issues and things like that. But mood, depression, Anxiety goes up exponentially. Sleep disturbance goes up exponentially. Guess what? If you're not sleeping, you're not healing. Sleep is absolutely positively necessary for health. And sleep disturbance is huge. And we also know that our thermodynamic center of the brain is highly affected. I mean, what do people talk about all the time? Hot flashes, night sweats. Yeah. This is because the thermodynamics of the brain are extremely hindered when you don't have estrogen around. Your skin dries up. We get wrinkles. We get all of those effects of a lack of estrogen. We have bone loss. Bone loss is accelerated, and every single year, the same number of women die of a complication of a fracture as do of breast cancer. Mm-hmm. And yet, breast cancer gets all that attention. When we look, and that is not even to mention libido, sexual health, vaginal health, continence, right? Like, women are not able to hold their urine anymore because of the health of the bladder and the urethra, because they're all lined with estrogen receptors. So this is a huge problem. And when we dismiss menopause and menopausal symptoms because we have bought into this crazy notion that hormone replacement is dangerous, and what we should be doing is looking at all these other solutions. So of course that is going to be the stance of the drug companies, and you just need to think for a moment, what would they rather do? Sell you hormone replacement, which is long off of patent and is available in a very inexpensive way in a generic formulation? Or can they sell you an antidepressant, a bisphosphonate for your bones, a memory drug, a blood pressure drug, a lipid lowering drug? I mean, right. The list goes on and on and on and on and on, right? Mm-hmm. And so something for sleep. I mean, I can name 8 or 9 drugs that they're going to sell you, or you can take hormone replacement. So anyone who just thinks about it for a moment logically knows why they wanted to reach that conclusion. And in fact, one of the primary investigators of the study said it's time for the runaway train of hormone replacement to end. That was one of his goals. And the reason is because that's what the pharmaceutical companies want. They want you to take 7 medicines instead of being on hormone replacement. Now, people say that it's unnatural. We, as women, if you were living 3,000 years ago, yes, it would be very unusual for you to live to 50 because you would have succumbed to an infection, or 3 million years ago you would have been eaten by an animal. Like, people just didn't get to that phase. But we're living in a time now where women are living 30, 40, 50 years past menopause. We need to live well, not just live longer, live well. I don't know about you, but I don't want to spend my last 20 years in a wheelchair because I had a hip replacement and it didn't work. Yeah. Or feeling lousy, or having my joints ache, or having dementia, having Alzheimer's. And it's avoidable, but we need to do the right thing by women. So the first thing we need to do is unlearn that horrible study, because that study isn't worth the papers that it was printed out on. If we really wanted to know what hormone replacement does and the safety or dangers of hormone replacement, we need to look at it in the proper population. So the population that we're talking about are perimenopausal women, are women who are just going through menopause, because we know if we let that 10 years go, the damage is done. Will you still get some benefit if you start to take it out past 10 years? Yes, in that you will stop the deterioration, and you may have some improvement of things like vaginal health and that kind of thing. But we have to capture women before they have the cardiac disease, before they have the brain disease, before they have the bone loss. So that study should have been on 50-year-old women, on 52-year-old women, on 53-year-old women, on 54-year-old women, but that's it. That's it. Mm-hmm. The average age in that study was 63. The damage was done. So how can we conclude anything from that study? And for some reason, they wanted to prove that it caused breast cancer. It wasn't there on the original statistics, so they data mined. And they went and found a subset of the population that they thought that they could prove that it caused breast cancer in. And then as it turns out, it wasn't even statistically significant. So that could have happened by chance. Yes. The study was so bad and has done decades worth of damage. There are women that believe that hormones cause cancer. There are physicians that believe that hormones cause cancer, and women are suffering and suffering and suffering. We have to think about it from a logical stance. If estrogen caused breast cancer, it would mean that women were put on earth for the purposes of developing breast cancer. How could that be? If estrogen caused breast cancer, why do we see breast cancer exponentially more frequently in postmenopausal women whose estrogen levels are barely measurable? In the populations that have the most estrogen, on young women, on pregnant women, they have 10 times the amount of circulating estrogen that women who are not pregnant have. But we barely see it. We see it in postmenopausal women, for the most part, that don't have enough estrogen around. Estrogen is protective. Estrogen is the hormone to live our lives. If we want to continue to live with vitality, then that means hormone replacement. And the breast cancer population is no exception. I believe in using hormone replacement in the breast cancer population, even in those with hormone positive disease.
That was in fact one of the questions someone's sending in. How do you do HRT with hormone positive breast cancer?
You do. And for years, estrogen and progesterone were used as treatment for breast cancer. So we have gotten away from that because the pharmaceutical companies have developed those drugs. But you have to go back and consider the source and consider the information. And we have to remember that, these women that get put on hormone blockade, we are shortening their lives. They may not be dying of breast cancer, but they're dying of heart disease. Women who have breast cancer and are treated for breast cancer are 2 to 3 times more likely to die of heart disease than women who are not. We cannot trade in one disease for another. We're doing the wrong thing. And by focusing on estrogen, because 70% of breast cancers are hormone positive, we have to remember 100% of normal breast cells are hormone positive. They're supposed to be hormone positive. That's the signaling pathway. And it's only the cancers that don't have hormone receptors on them that are the dangerous ones, in that those are the ones that have gone off of the signaling pathway. Those are the ones that are not following the rules, that are not following normal procedure. Now, am I saying that no one's going to die of a hormone positive tumor? No, absolutely not. Because it's about way more than that cancer. And that's why I don't focus too much on that pathology report. When people identify with, oh, I have a hormone positive cancer, I have this, I have a triple negative, I have this, that, what I'm looking at is, why do you have cancer? Because those other things that people are talking about, the HER2 positivity, the hormone positivity, the hormone negativity, that system is built for the pill for the ill system. It's built for the you have this, you take that system. That system doesn't work.
Mm-hmm.
That system is a system of band-aids. That system is a system of kicking the can down the road and we'll just deal with it later. That's the whack-a-mole system. That's not what I'm interested in. I'm interested in helping people to discover their imbalance, to discover what is not working, to discover whatever is blocking their path to health, and helping them to remove their roadblocks and get the health that they want and they deserve. And that's what's doable, but you have to come at it from a different perspective.
Yes.
It's not about the tumor.
And it's not about estrogen.
It's definitely not about
You can't.
estrogen. Estrogen is protective.
How it's almost everyday conversation, me and the patient about exactly the same thing. So yeah, patient or talking to the other physician, OBGYN, or another GP who not want to do like more than 3 or 4 years of HRT because of risk of breast cancer, increasing risk of breast cancer.
But there's no data that supports that.
No.
It doesn't exist. And in fact, there's plenty of data to the contrary, both in the hormone replacement population that doesn't have breast cancer and in the hormone replacement population that did have breast cancer. I mean, though there aren't a lot of studies and the numbers aren't huge, there's 10 or 12 studies of women who have had breast cancer who then go on to take hormone replacement afterwards. And all of them found either no increased risk of recurrence or a decreased risk of recurrence. That's enough data for me.
Yes.
And I see it every single day. Listen, if women are healthier, if women are happier, that is going to decrease your risk of recurrence. There's nothing that can bring a cancer back stronger than misery and pain. That is almost a guarantee. So I remember I was talking to my friend Susan, and she had breast cancer, and then she had a recurrence, and then I saw her 2 years later, and she looked like, I don't know, $1 million isn't even a lot anymore, but she looked like today's equivalent of $1 million. And I said to her, like, what happened? What did you do? And she said, I had a husbandectomy. Like, sometimes that you need to do whatever you need to do to get healthy. And that is often figuring out what's driving your disease. And what was driving her disease is her very, very toxic marriage. And she got out of it. And I don't want to paint a rosy picture, because her life was hard for a little while. Like, it's hard to go from living your life one way in a marriage and that kind of thing to going out and being on your own. And when you don't have a nice divorce, the people that you're leaving try like hell to make your life horrible. And her husband did try to make her life horrible. But the truth is that getting out of that relationship, and my friend Grace says this, the more stones her ex-husband throws at her, the more she comes back at him with love. Because it's really hard to fight with someone who doesn't want to fight with you.
Yeah.
And it's not easy. I'm not saying it is, but these are the things that are within our control. And this is why gurus like Dr. Joe Dispenza and you know, all those major people that are out there talking about meditation, this is your power. This is your ability to decide what affects you and what doesn't. That's the magic of meditation, is that you develop this muscle, this strength, this incredible ability to decide what affects you and what doesn't. Because that's how you're going to control your chemistry. And it's all about controlling your chemistry, sending up that safe signal, sending up that flag that says that I'm okay, everything's okay here.
Yes. To, if you can, to remove that trigger or stressor out of your life. And if it's impossible, then start working on especially meditation and stress reduction, managing that stress.
Yeah, absolutely. Now, is meditation going to get rid of heavy metals and mercury levels and microinfections and, you know, the other things that have poor effects on our health? No, it's not going to be everything. And if you're really struggling with your health, it's probably going to be a number of things that you're going to have to bring together. But that's okay, because you're so worth it. And the truth is, at the end of the day, the only person that can get you healthy is you.
And that's you mentioned about detoxification, and beauty of functional medicine is to get to the root cause. So find out where this toxic coming from and try to remove, rather than putting Band-Aid on it, and just remove the symptom.
Yes. I love Jeffrey Bland's tack theory, which is that if you have a tack in your foot, you can take a lot of aspirin and get rid of the pain, or you can remove the tack, right? And so what we all need to do is remove the tacks in our lives.
Yes, exactly. Shall we get into a little bit of screening, this breast cancer screening?
Sure.
And what you're doing.
I hope you don't get canceled.
So first, right now we know, of course, mammogram is the main way of breast cancer or breast screening every 2 years, or in people higher risk, dense, to have every year or every 6 months, every 3 months, having mammogram, and in higher risk people to go for MRI scan. So that's kind of a routine right now. What are your thoughts on that? And I hear about some of your new adventures.
So my thoughts are that getting frequent mammograms is the way to ensure that you're going to get breast cancer. Mammograms, though it has a very nice, lovely name, picture of the breast, it's radiation. It's radiation. And if we called it by what it was, I think people would approach it with more trepidation. But women are being lied to. They're told that mammograms save lives, and it's a lie. It's not true. They do not save lives. They cost lives. And in the studies that we've seen, it's been demonstrated time and time again that for every one woman whose life is saved in 2000, we're going to harm 10. We are doing a lot of damage to women. And the denser your breasts are, the more damage we're doing. Mammogram is really a way to guarantee that you get breast cancer. And the more mammograms that you have in your life, the higher your risk is of getting breast cancer. If I didn't have another solution, I don't think that I would be so vocal about it, because people say, you know, why are you coming down so hard on mammogram? I want to empower women, and I think that one of the major reasons, even if you can logically understand that how can a mammogram be completely safe, right? It's radiation. Everyone understands. But they think that there must be some benefit or else my doctor wouldn't be telling me to get it, or else, it wouldn't be so common. And it's like they believe it because it's true. And also they want to do something. They want to be proactive about their health. And I understand that. I completely understand that. But the problem is this is not the thing. It's not the place. And it's really only feeding the system. It's really only creating more disease. The mammographic screening program was built on this premise when it started in the 1970s. It was built on this premise that breast cancer growth is linear and predictable. So breast cancer is something that starts small, grows to some critical size, at which time it is more likely to metastasize. And if we could find women before it hit that critical size, we would save them from treatment. They would get to have less treatment, and we would save lives. It's a lovely theory. It just doesn't happen to be true, because breast cancer growth is neither linear nor predictable. So that means that breast cancers are what they are from the very beginning. Their biology is what it is from the very beginning. It doesn't start off all the same and non-aggressive and then get to a point where it becomes aggressive. That's just not how breast cancer works. If you're going to have an aggressive breast cancer, you're going to have an aggressive breast cancer from the very beginning. And if you're not going to have an aggressive breast cancer, the same is true. It's not going to get to some point and then convert or change or anything like that. So it makes no sense to take a healthy population, because that's what the screening population is, and use a test that causes breast cancer to screen for breast cancer, because we're actually taking that healthy population and making them unhealthy. And this is a major problem. Now, when we look at the population that screens as compared to the population that doesn't, and we know this from some of the European studies. So in these studies, their ability to access medical care and the kind of medical care that they got was exactly equal in both groups. So we're looking at women that screened and women that didn't. And there are no more deaths from breast cancer in the group of women that don't screen. It does not save lives. There are more breast cancers in the women that screen than in the women that don't. And the reason is, first of all, we're causing some of those breast cancers, and we're overdiagnosing. We're picking up breast cancers that would have never been clinically relevant. So in the United States, no matter how many mammograms we do every year, the exact same number of women present with aggressive disease. And no matter how many mammograms we do every year, the exact same number of women die of breast cancer. We are not impacting that bottom line at all. We are not changing the number of women who develop aggressive disease, and we are not changing the number of women who die of breast cancer. All we're doing is causing breast cancers and causing people to be treated for breast cancer that don't need treatment. And this is a huge problem. It's costly to the system, but beyond that, the impact that it has on the woman is tremendous. A woman, once she is told that she has breast cancer, and I'm not even talking about the misdiagnoses, the women who are treated that didn't need to be treated and don't have disease. I'm talking about the women that, maybe they do have DCIS or non-invasive disease that would have never killed them. Those women are never the same for the rest of their lives. And in fact, being diagnosed with and treated for DCIS decreases your lifespan, doesn't increase it, decreases. Even though it's non-invasive disease that would have never killed them, the treatment makes them less healthy. And then there's the small invasive cancers that would have never come to be clinically relevant. And then we take these women and we give them surgery, which is deforming and psychologically damaging. And We give them radiation, which directly, depending on which side you're talking about, but damages the tissues of the breast, damages the chest wall, the muscles of the chest wall, damages the bones, so that you are subject to a rib fracture from something as innocuous as a sneeze for the rest of your life, damages the lung, gives restrictive lung disease, damages the heart and the blood vessels of the heart, the musculature of the heart, so causes heart disease. And on top of it, you are susceptible to yet another cancer because of the radiation. And then there's all the stuff that we talked about with the hormone blockade, accelerating heart disease, accelerating brain disease, accelerating bone disease, losing your libido. Like, don't discount that. That is something that's very major. How many relationships have been destroyed because the woman no longer has interest in a physical relationship? Or how about just having sex be enjoyable and not painful? How about being continent and not peeing in your pants and wearing diapers for the rest of your life? Like, these things are meaningful. And while I'm on that topic, I have to say that even if you're not considering systemic hormone replacement, but I hope that after our conversation today, you truly are considering going on bioidentical hormone replacement. But even if you're not, please use vaginal estrogen. It is 100% safe for everyone. It is not associated with an increased risk of cancer. And we all need healthy vaginas and healthy bladders. Life is miserable if you have vaginal pain, urinary incontinence. It's miserable. So at the very, very least, everyone should be considering that. But, you know, we have to really back up and rethink this whole system again, because we should not be subjecting healthy women, which is the screening population, we should not be subjecting them to a test that causes cancer. It makes no sense. And we are not helping people, we are hurting people. Now, if you want to screen for breast cancer, there are some genuine good screening options. One of them is self-examination. And so I fully believe in self-examination. I think that everyone should know their breasts. I think no one is going to know your body better than you know yourself. You should know what you feel like so that if something changes, you recognize it. Is it going to be tiny and early? Maybe, maybe not. But that, what I'm saying is that that ultimately is not going to be the difference in how you do. And it avoids picking up all these meaningless things. So I fully believe in self-examination. It should be done once a month. You should both look and feel your breasts. So look at your breasts, look for changes in the skin, dimpling, redness, change in the shape of the breast, both arms by your side and up over your head. And then you should feel your breast. And breast exams are best done with the fingertips because that's the most sensitive part of our hands. And just going around your breast in a radial fashion from the outside to the in towards your nipple. And if you feel something, it's going to feel like a bump in the road. Now, as much as I don't believe in mammogram for screening, I am all for using our medical inventions and our medical technology for diagnostic purposes. So I am not saying that no one is ever going to have a mammogram again. What I'm saying is that no one ever needs a screening mammogram ever again. But if you find something, you're no longer in that healthy population. I'm not saying that you're not healthy, right? What I'm saying is that once you get out of that asymptomatic population, now you have a symptom, now you have a finding, now you have something that we need a diagnosis for, you're going to have diagnostic studies. And that's okay, because that's what we should be, that's how we should be using these studies. But we should not be using them on healthy people that we're creating disease in. So The other way to screen is thermography. Now, I want to be clear, thermography is not a screening tool for cancer. And that's why it got such a bad rap, because people used it as a screening tool for cancer. Thermography is a tool to look to see if you have inflammation. So I think people should be getting whole body thermographies. I think we should know if we have inflammation in our body, because that gives us the opportunity to clear up that inflammation. Knowledge is power.
Mm-hmm.
If they find something in the breast on thermogram, then have an ultrasound. That is sensitive enough.
Mm-hmm.
But all of that is kind of a moot conversation. I still believe in thermography because I want people to have whole body screening for thermography to own their health and to know that they're healthy. But for screening the breast, there is not going to be a better test than the QT scan. There's just not. It is going to completely replace everything. It's going to replace mammogram. It's going to replace ultrasound. It's going to replace MRI. And it's just not for the breast. The current device that's out there now is out there to screen the breast, but the whole body scanner is coming in a couple of years. And it will change how we image forever. But in the meantime, this is an opportunity to screen your breast without radiation, without compression, without pain. It's fast. It takes anywhere from 10 to 20 minutes, depending on the size of your breast. And it's FDA cleared. And it is the most sensitive and specific test that we have. It's not readily available now, but within 5 years, they're going to be everywhere. Mm-hmm. And I want to impress on people that no matter how many notifications that they send you that you need a mammogram, no one needs a mammogram. No one, ever. Even if you feel something, you don't need a mammogram. If you feel something, you're going to have an ultrasound. No one needs a mammogram. So we have to, I am coming to Colorado. It's happening everywhere. So I get every single day, when are you coming to so-and-so? When are you coming to so-and-so? I'm opening 7 this year. I'm opening 20 the next year. There'll be 100 open in 5 years. Like, they're going to be everywhere.
Wow.
They're going to be everywhere. Don't worry.
So then what is the recommendations, or if there are any recommendations so far for this screening with QT imaging?
So
every year?
The screening is going to be every year. But if you have a test that has absolutely no findings, because this test is so sensitive, you really don't need another exam for 24 months. So every other year. But people are nervous about that. Like, women want to have a test done every year. So the wonderful thing about this is that it won't hurt you. There's no way that you could have any damage from this test. So if you want to have it every year, if you want to have it every 12 months, have it every 12 months. But just know that there is a genuine possibility that you will only need it every other year.
Mm-hmm. Great.
Yeah. I know everyone wants to know when it's coming to them.
No.
It's coming. I promise. It's coming.
I have to figure out things here in Canada. I don't know if you have any information about Canada.
Canada's getting one.
Okay, that's good. So just to
don't make me say more, but Canada's getting one.
Just to wrap up, start working on your lifestyle, start working on the stress. That's the main thing. Work on your environment, detoxification. Yeah. That's a good place to start. And there, talk to your provider, health provider, and ask about hormones. If this is the right time, at least start having the basic blood test. Check your hormone levels. I think that's a good place to start.
I think the most important thing is going to be that so we know that perimenopause and menopause is about a 10-year process, right? Mm-hmm. And during that time, our hormones are all over the place. So when you measure one day, it can look one way, and when you measure the next day, it can look another way. So I don't rely too much on measuring hormone tests in the perimenopausal woman. I'm listening. I'm looking. Tell me what's happening with you. What symptoms are you developing? Are you having problems sleeping? Are you waking up at night with hot flashes? What's happening with you? And by listening, we know which hormones do what, and we're able to support women. And you're going to meet with them every couple of months and listen, what's happening with you, and adjust accordingly. Now, it's a lot easier in a postmenopausal woman because then you just know you're measuring whatever you're giving them and they're in a steady state.
Yeah.
But in that perimenopausal time, we need to be having these conversations with our patients. We need to be listening. What is going on with them? And we need to be helping them every bit along the way. We have the ability to do this. And if your doctor isn't listening to you, if your doctor won't have these conversations with you, I hate to say it, you need a new doctor.
Yes.
This is all about a partnership, and that you need to be invested, but so does that partner.
So anything else you want to add to?
Well, for anyone who is on a breast cancer journey, my new book is coming out in about 3 weeks. It's called The Smart Woman's Guide to Breast Cancer. And it's really everything that you need in order to restore your health after a breast cancer diagnosis, prevent recurrence, and live your best life. I wrote this book so that people could make informed decisions, because too many people are making major decisions about their health without having all of the information. So this book is all about what even is breast cancer? What does it mean? What does my pathology report mean? What are these treatments that they're suggesting to me? How are they going to help me? How are they going to hurt me? Because they're not having enough conversations about that. And then this is your plan to go forward. These are the lab tests that everyone should know about themselves. These are the nutrients that you need to make sure that you have. These are the foods that are associated with wellness and longevity, and movement and sleep and toxins and detoxification and lifestyle and all of those things that help you to lead your best life. And it's really about prevention. It's about driving health and preventing disease, because we know that when we do the things that drive health and avoid the things that don't, disease goes away. So look for that on Amazon in a couple of weeks, called The Smart Woman's Guide to Breast Cancer. And then, of course, there's my podcast, Keeping Abreast with Dr. Jenn, and we're going to have you on my podcast real soon. And a new episode comes out every Monday. So if you like what you heard today, you can listen in every week.
It's great. So informative. I love it. I listen to that. It's just so good.
Thank you.
You have so great selections of people, and I love.
Thank you. Thank you so much. And it was such a pleasure to be with you today.
It was great. It was lovely. So much information, and people know where to find you. So it was lovely. Thanks, Dr. Jenn.
My pleasure. My pleasure. So great to be here with you today.
See you soon, hopefully.
Yes, absolutely.
Take care. Bye-bye.